So I'm Dr. Peter Nakaji, and I'm now sitting with one of my colleagues from plastic surgery who I work closely with because we want to emphasize how important the plastic surgery and reconstruction part of neurosurgery can be. Neurosurgery often happens on very cosmetically sensitive areas, on the head and neck, and that's where a lot of our identity is. And so I think it's very important that we know how to restore things back to normal. And the reality is none of us as neurosurgeons necessarily are the only people who can do that, or possibly even do that part the best. So we can work with talented plastic surgery colleagues like my colleague here, Dr. Vasas Sabi, who has joined us today to talk about that part of the neurosurgical journey. One of the things that the patients are going to want to know is what kind of conditions are we talking about that plastic surgery and neurosurgery really work together. So what are some examples of some cases that you can think of that we have done together, or even you've done with other neurosurgeons?
Yeah, it's a great question. I would say the most common surgeries that I get called in to work in collaboration, and I think of cases that you and I have worked with, I would say the most common ones are patients have maybe had a previous either trauma or cancer that they're missing a piece of bone from their skull, or they maybe have some abnormality or scarring adhesion. They may have had a previous infection. And they're missing some skin or soft tissue, or maybe there's a deformity.
Those are areas I think are really very helpful for us, because if everything just pulls back together, most of the time we don't involve plastic surgery, but there are plenty of times when some piece of the edge of tissue, for want of a better word, dies back, and it leaves some exposed bone. The brain could be at risk of being exposed. We could have spinal fluid leak. So I think all of those cases, and we know that many of our patients have had prior trauma. They may have had damage like burns at some point. They may have had infection, radiation that's made the tissue to be compromised. And certainly sometimes we are doing large removal of the edges of bone back and replacing it with one of these artificial implants.
Right. And I can think of several cases that you and I have worked together over the years where patients had a previous traumatic injury to their face or their skull, and there's bone missing or there's a defect, and it's involving the brain or near the brain or into the bone, where that collaboration really gives the patient the best overall outcome. Not just from my standpoint as a plastic surgeon, where the skin and soft tissue and scarring, but also making sure that the deeper tissues or the bone or sinuses really get brought back to a more normal state.
Yeah, that's the reconstructive side, of course, is if some critical structure is being exposed because of the loss of that tissue, then restoring it will be better, in terms of just safety for the patient. It may be really necessary. And the other part of it, of course, is we do see that we use hardware of various times to restore the bone contour, but sometimes that does become exposed. It may wear up through the skin, may bend up and become prominent, uncomfortable. So those are, I guess, some other cases that we've seen where working together really makes a difference.
Right. And I think of the few patients that came to us with, the scarring was bothering them, or was painful, or they were missing hair over kind of concerning areas that were exposed, and it was uncomfortable. It affected what we call their activities for daily living, their functionality. So those, I think, when you and I were speaking, the most common kind of patients that should reach out to us and have reached out to us over the years.
Yeah. Well, at some point, we'll talk a little bit more about all the other areas, like spinal reconstruction, when a wound in the back doesn't heal right, or other areas of the body. But I think that's a good review of kind of the more major areas in which we find that working together mutually is beneficial.